Welcome to another edition of the What is Global Health podcast. Today we'll be talking to Dr. Diana Hernandez, an assistant professor of sociomedical sciences at Columbia University's Mailman School of Public Health. Her research focuses on the vast health and social implications of housing in communities, with an emphasis on how energy insecurity in housing and neighborhoods can affect health. Much of her work stems from her native South Bronx neighborhood, where several of her current projects relate to structural interventions in low-income housing to alleviate the consequences of poverty on health. Thank you for joining us today, Professor. So, can you explain for those viewers unfamiliar with your work what factors related to housing and community structures can impact health?
From an environmental health perspective, the connections between housing and health are about exposures within the housing setting. So issues like lead and pest infestation and mold, even conditions like crowding, for example, all kind of impact health and quality of life. From an environmental health perspective, from a more sociological perspective, the connection is around affordability, it's around stability in housing, and it also has to do with the conditions. So to the extent that housing is a kind of a stable place for people to kind of relate to and connect to not only that physical space, but the kind of broader neighborhood environment that's kind of connected to issues around health, and then affordability also has implications for health, mostly in the route of or as it relates to stress and mental health. Now, my work is both about kind of creating a lens by which to consider housing as more than homelessness, for example, right? So a lot of the work that's been done is, looking at issues of homelessness, and then, kind of people that are housed, and like I said, then there are these all, for people that are housed, there are all of these kind of issues that are going on. I call them the three pillars of housing: quality, stability, and affordability, and how that kind of relates to health. But my other gift, that's how kind of I like to call it, is really kind of the conceptualization of this issue of energy insecurity, which is defined as kind of so it's basically an inability to adequately meet basic household energy needs. And by that, that's kind of a multidimensional construct that not only takes into account the physical kind of infrastructure of housing, but also the affordability of energy and the kind of behavioral responses when the physical and the economic dimensions of energy insecurity are, kind of presenting particular challenges. Then people are doing things, right? They're kind of expressing some level of agency and trying to control the situation in one way or another, sometimes to the detriment of health.
Okay, I see.
And I think that more if you want to unpack it, but I mean, basically that's a big part of my work.
And also, looking back at one of your studies in 2012, you and your research team suggested a policy proposal to increase incentives to implement energy efficiency measures. So, can you explain this proposal and how it can change utility burdens on low-income tenants?
So basically, this is a split incentive paper, and it was published in Energy Policy. And basically, the idea is, how do we create the necessary incentives within kind of low-income rental markets for landlords to make decisions about incorporating more energy-efficient measures and infrastructure within the kind of residential settings of low-income renters. And part of that was about, creating through the utility companies on-bill financing. So, with the idea that there would be some savings that are attached to these upgrades, those savings can basically, whatever the cost savings are, can be redistributed kind of back to the bill with essentially kind of a monetary incentive to the landlords and then that would be paid off over time,
Mm-hmm.
so that the utility companies are an invested partner in upgrading, low-income housing, and landlords are given the kind of necessary financial incentive to, kind of motivate that change.
Mm-hmm.
And the benefit would be to the rent. Well, I mean, there are benefits for everybody, but directly for the renters, for the tenants, so that they might live in a more comfortable and cost-effective, efficient environment, for the landlord, so that their property values increase, and so that they're able to do the necessary upgrades with the necessary incentives. And for the utility companies, particularly in states that have, kind of new regulations that are requiring a reduction in carbon emissions, that they might be able to also kind of achieve that through targeting this segment, the customer segment.
So implementing help from both the utility companies and also the landlords. So it's like a huge community effort to help these low income tenants.
Yeah, and one thing that I have since, I mean, so 24 was, a while ago, and I've since thought a lot about the behavioral pieces, and so I've come to believe that it's not, it's not enough to just upgrade the system. That's a huge part of it. But I think it's another way that we can engage residents. So if I had to kind of update that paper, I would do a little bit more in terms of saying that there's a way in which we should be orienting tenants and even low-income homeowners to the energy systems in their home, and everybody. I mean, I think that all consumers can benefit from this, but I think particularly those for whom cost is a significant barrier, that they might, also be kind of more engaged in terms of energy conservation education, so that their kind of behavioral responses to energy in their home environments can be more conducive to health.
Most of your research on housing and energy insecurity stem from the South Bronx neighborhood. So, how do these findings fit into the larger picture of global health, such as like maybe in different countries or different cities where there's like different weather and social environments?
So the connection to the South Bronx, I guess, is kind of multifold. So, the South Bronx continues to be a deeply impoverished neighborhood, kind of historically speaking, underprivileged in a variety of ways. It's also the place that I grew up in, and that as a Columbia professor, it's really an honor for me to engage my community, like the community that shaped my very existence. And so that's part of the reason why I, do so much in the South Bronx, is because, I think it needs a lot of attention. So if you think about the UN sustainability goals and the kind of relationship to the kind of broader picture of development and of addressing issues of poverty on a global scale, then energy becomes a route to do that on two levels. So on the level of, basically getting people access to the grid and addressing energy poverty issues is about recognizing that we need energy for everyday existence, to do the very basics of, cooking and lighting and being able to kind of function on some level. And that's, from a global perspective in the developing world, some of that is about connectivity to the grid, for example, and electrification to begin with. In the U.S. context and in a lot of other developing countries or developed, then the issue is a little bit different in the sense that it's about affordability and equal engagement in kind of modern energy technologies. And that's a very, it's a different kind of issue, but, an issue nonetheless. And, kind of what can draw a parallel between poverty as it, kind of occurs in the U.S. context, and then poverty as it occurs globally. And, climate change, the other connection around poverty and energy is that, the poor, by their own actions, have a very low carbon footprint, right? I mean, I think part of it is the way in which, poverty basically requires attention to detail in terms of consumption. And at the same time, there are aspects of that, that are beyond the control and the decision-making authority of the poor. So, for example, this is in the rental context, but, how efficient the buildings that, a low-income family might live in, that's kind of beyond the purview of the decision-making authority that a poor family can make, and yet they're implicated. And, while on the one hand, kind of the issues that one can control, or that like lower-income families and households around the world can control, they're doing what they can to live green, just inherently by necessity. And yet, there are other kind of issues that are happening that make them kind of less efficient, and thereby, having a higher carbon footprint than need be. So those are the connections that I see between, the very local, right, like the kind of community continues to be challenged by issues of inequality and, energy, and health disparities and all of these things, and how it kind of relates to these larger manifestations of inequality and, these kind of concepts, the larger concepts of climate change.
And also, can you explain more about your recent renovation project in Mott Haven and how it can be a practical application of your research?
So I'm really privileged and honored to say that I understand housing from this very academic perspective, and be able to kind of translate a lot of these ideas into an kind of a social entrepreneurial venture. And so basically, I have been buying and rehabbing small buildings. I mean, I don't claim to be a large developer or anything at all. I am a small kind of investor in my neighborhood, first of all, and secondly in these small buildings. And basically, the rehab have I think they've improved over time, for sure. But they're kind of driven by this desire to incorporate healthy, sustainable design principles, and to think about revitalization that's coming from within the neighborhood rather than from other people that are outside of the neighborhood deciding that it's a hot market and, exploiting it to the disadvantage of people that are living in the neighborhood at present. So my work in real estate is in some ways driven by a vision for creating opportunities, housing opportunities for people that kind of want to live in the Bronx and stand by some of the principles of connecting to neighbors and being part of something. And at the same time, it allows me to toy with these ideas around the importance of housing.
So having a really in-depth relationship with these issues have influenced your research?
I've learned so much from doing renovation projects about some of the tensions and the challenges that make incorporating energy efficiency more challenging. For example, for property managers and owners. So when I talk about the role of landlords, I'm not talking about it from the perspective of someone who is so distant. You bad landlord, you should be doing more. I mean, I really come at this from the perspective of someone who is a housing provider, and understand that there are these kinds of trade-offs that one makes around decisions like, how do you put solar in or don't you put solar in? And if you do put solar in, who benefits from the solar? Like, all of those kinds of decisions I've had to face in my reality as a housing provider. And that's, I think, made my work more relevant, really, and maybe more informed by some real world issues, not what theoretically should or shouldn't happen. I think the other thing that has helped me with my real estate, frankly, is that it just made me a more confident project manager, and so I'm able to balance a pretty significant research portfolio, productivity around publications and other things, with the confidence of having accomplished, like, the total kind of renovation of one, uninhabitable places. And there's something to be said about that. Just as a, from my own perspective as a professional and like kind of my own personal growth.
It's great to have hands-on experience with working with these tents to better understand the effects of energy insecurity. So recently, you have also studied HIV and hepatitis C virus testing rates in substance users in both the US and Puerto Rico. What do your findings say about the current relationship between political leaders or community services and these patients?
We can look at the lens, we can look at so many different health issues, right? It can be respiratory illness, it can be, smoking behaviors, HIV and Hep C, and a number of issues. And what we see kind of as a connection is that a lot of the risk factors are really in poverty and in the kind of deficient environments that poverty basically festers. And that is the connection between, like the people, the politics that aren't always necessarily, in the best interest of the people, and just how big some of the kind of challenges are in terms of being healthy. Part of that is about what people are eating, what they were exposed to in their, in terms of ambient air, and so many other issues. And, the Bronx, I think, in some ways, because it's so close to my heart, and it has so, like, kind of suffered from so many of the social and environmental and economic challenges, and even the kind of political, I don't even know the right word to be so politically correct. But we'll just call it, like, political challenges. The Bronx has some of the highest HIV rates in all of New York City, some of the highest pregnancy rates. I mean, it continuously ranks the lowest in the county health rankings. All of those things mean that when I'm thinking about this community, when I'm thinking about solutions to the community, I can't just be necessarily thinking solely about the people who suffer from asthma, because they have a cousin or a mother or a brother who's incarcerated, and that has implications for mental health. Kind of suffering from some of the chronic illness like diabetes or high blood pressure, who died early. Like, these are all of the kind of health-related traumas that are experienced in this community. That I've been very fortunate to be flexible in the way that I look at the different issues, but the substance use and HIV and Hep C piece really comes out of my support for an organization called Blue Health that offers comprehensive health services. I used to be on their board. I no longer am, but they continue to be an organization that I champion because of the kinds of services that they're providing for the whole person. And they first present as substance users, but in fact, the things that are happening to them are very consistent with a lot of the challenges that other people in the neighborhood are facing.
So would you say that one of the main challenges is increasing the transparency of HIV and substance use rates?
I don't know if those are secret. I would say that, in places like the Bronx, actually, they're pretty well established, where they are more of an invisible risk, is in areas that have been receiving a little bit more attention more recently, like the suburbs, like the exurbs, like rural areas, areas that actually, at first glance, people think of them as, kind of Trump nation, and for all the images that might conjure up. But in fact, a lot of these places are becoming the repositories of the places where people that are displaced from urban areas are now relocating and calling home. And
Mm-hmm.
so it's not as simple as saying that, the Indianas of the world or the Vermont of the world or whatever. And I'm talking about states here, but, all of the kind of small, like Western Massachusetts, for example, one could think of those as traditionally kind of white areas that were at some point more manufacturally based economically, but these are now home to the Puerto Ricans that used to be living in New York, or to the African Americans that can no longer live in the Boston area. That's so I think thinking about diversity and substance use issues as a national epidemic, but also recognizing that these places are much more diverse than we give them credit for is important. And I think that was also like one of the areas that connects. So why I'm saying that is because you were talking about the invisibility of these risks and threats, but that's not true. Certainly not in places like New York City where they have amazing statistical capacity, and where the Department of Health, for example, has really tracked in a very systematic way the prevalence rates and new incidents of particular diseases. It's in these other places that don't have capacity to do that the epidemics are more violent.
So we have time for one more question. So what part of your research interests you the most?
I'm fortunate to have, such a breadth of, kind of different interests. I'm really excited by the fact that, there is a connection. Like, to me, the root of my work is really thinking about place, and how that shapes people's realities every day and in the long term. I really am most likely kind of
Mm-hmm.
excited about my work in the energy space, partly because there's a lot more to be learned in terms of the connections between energy and health, and how low income communities and households are interfacing with these energy realities. There's also a lot more to be done as a result of this kind of, I think it's an invisible epidemic for sure, this question of energy insecurity, how little we know about it, and how little people seem to worry, except for the people that can't pay their bills and are kind of faced with the threat. And so that really, it excites me. I think that there's another part of it, which is about diversity and the fact that a lot of these energy-based conversations are happening not with people of color at the table, not with women of color at the table, and certainly not with people like me who have intersectional realities, and that can bear some truth to a power issue, and a power issue that's based on energy, but it's also based on other sources of power that need to be questioned and that need to be challenged, and that really excites me.
Yeah, and I'm sure having a close relationship with the root of your research in the South Bronx must have been a huge motivator in your research.
Yeah, I mean, if I had to, I sometimes want to pinch myself because I think, I always wanted a PhD to be able to give back to my community. That was always kind of a motivator. It was never about the doctor in front of my name. It was never about the PhD behind it. Like, it was always about, trying to be a role model and to be in service. And I realized that being an academic isn't something like, you're removed because you're thinking about the issues and you're investigating them and examining them from different angles. So I'm really proud to say that I, have a connection to this place that is really special to me, and, that continues to fuel good ideas for my research, and where I'm hopefully, in a small way, but in some way giving back.
All right. Thank you so much for your time, and it was a privilege for me to talk to you.
Yeah. Thank you. Thank you so much.
Yeah, we at the Journal of Global Health really look forward to following more of your research too.
Perfect. Yeah, thank you. Thank you for doing this.